wanted to bring today's episode to the podcast talking all about erectile dysfunction. When you're on the fertility journey and your partner is dealing with this, there could be a lot of confusion, may not know what to do. Maybe he's been dealing with this for years. And so we're giving you practical steps that he can take right now to reverse erectile dysfunction and really help as you are on this fertility journey, improve intimacy, and then ultimately get pregnant naturally. So excited for you to listen. Let's go. Hey, Dr. Ann, excited to have you on the podcast.
I'm excited to be here. Thank you.
Awesome. So today we're going to be talking, like we said, all about erectile dysfunction, or ED, as it's known. So many people. So we're working with couples here that are on the fertility journey. A lot of the times it's women that's reaching out to out to us. We work with people that are single, but it's always working on a couple, because it's not just, even though we're working with people with female factor infertility. A lot of the times we're seeing issues with the male partner, and no one's even looking into their health. And with ED, we are seeing a small percentage of people dealing with that. And then sometimes with guys, it's difficult, subject to broach. And so I wanted to bring this episode here to kind of give some information and things that they can do right now to tackle this issue. So I guess kind of like, let's just explain what exactly is erectile dysfunction. I think people know that have it, but maybe just kind of give us a brief intro of what that is.
Right. Well, erectile dysfunction, the definition is very broad. So you can still have an erection and still have ED. So the definition means that it defines if a man has an inability to have penetration and all the way to orgasm and ejaculation. So what that means is that if a man has an erection, but he it's not as firm as it used to be, that's ED. Or if he has an erection and and it works well, and then he loses it during the sexual encounter, that's ED as well. Or that it takes longer to get an erection, that's ED. Or premature ejaculation, or even delay ejaculation, that's ED. Or even the inability to orgasm or delay or orgasm, that's ED. So it's a whole spectrum. It span all the way to total impotence as well. So that's why with that definition, and I really like that definition, because it really give a man kind of like a warning sign that a man erection is really an indicator of his general overall health. Right? I wish a woman has something like that, actually. We have this a similar organ, the clitoris, or a woman clitoris is like a man's penis. And it's interestingly, I want to point this out to your listener. It is the only organ in your body for a female that is purely for pleasure. It has no other function other than pleasure. Versus a man's penis, it is used not only for sexual activity, for erection, but it's also used where he can urinate, but also where he can dispel semen. So there's three functions for a man, but for a woman, it's a pure pleasure organ, and it should be used as so. And did more than just what you see on the outside. It actually goes inside. It's 4 inches long. It looks like a wishbone. So it goes deep and it goes along the side of the labia. And so I wanted to kind of point that out, that, it's there, and it's there for a reason as well.
Awesome. Yeah, we've done many episodes on female pleasure and intimacy, and especially when we're on the fertility journey, because a lot of the times this can just become all about baby making, and people are not even enjoying themselves anymore. And then with the pressure that maybe in this case that a male partner might feel to perform, and like she's like, I'm ovulating, like lickety split, let's go here, and all the the pleasure they've had together, it could just be very like it's not fun anymore. It just becomes work. And so
It becomes mechanics. Yeah, yeah. It becomes work instead of being fun. And interestingly, you point that out, because for a man to have a full erection, he needs to be relaxed. So the brain is the largest sexual organ. So he needs to relax. He needs to be in the moment. And if his head is out of the moment and thinking about more, okay, we gotta get it done in 5 minutes. She's ovulating, her temperature is rising right now. It's actually detract the man from having a full erection. And if you don't have a full erection, it will also affect the amount of sperm that gets delivered. And the muscle in a man, the muscle that propel the sperm from leaving the prostate. Well, sperm is made in the testicles, but then it kind of goes to the prostate and store in a little sac called the seminal vesicle. And then when a man ejaculates, that goes out with the fluid from the prostate. And the fluid in the prostate is what keep the sperm alive. And so, but the force of that explosion of the sperm that comes out of the prostate, which help propel the sperm to go up the vaginal canal and then the uterus, it's actually in the pelvic muscles. Those muscles are the pelvic muscle or the Kegel muscles. And what we find is that men have very, very weak pelvic muscles. And when it's weak, it will affect the amount of fluid or seminal fluid that gets expelled, and therefore also affect the amount of sperm that gets expelled as well. So something to consider because, not, a lot of men, I would say 99% of them don't do Kegel exercises until they listen to my podcast, and I will discuss it as one of the pillars that I discuss about for a man to have good sexual health is to do Kegel exercises or strengthen his pelvic muscle, because those pelvic muscle does three important things. It helps with their erection as well. It also helps with the intensity of the orgasm, and it also helps with the ejaculation as well. There are two little muscles that run along just aside the scrotum, below the scrotum, and then it goes up and it wraps around the base of the penis.
Yeah, that's something that we haven't really heard about actually talked, right? Where it's always about women doing Kegel exercises, and even there's debate about that piece. I guess seeing more of a pelvic floor therapist, but doing it. What do you see a pelvic floor therapist for as a man then to work on this?
Absolutely. Absolutely, because a lot of even myself, I thought that, oh, I'm a doctor, I do sexual health, I know how to do Kegel. I find out I was doing it too strong. So I actually went to a pelvic floor therapist to get therapy because I found that when I was contracting the pelvic floor muscle, which are only two little thin muscle but powerful muscle, I was also contracting my buttock muscle, and I was contracting too many muscles. I was doing it too strong. So when you do it too strong, it doesn't work well. And so I advocate that men and women, you don't have to go to a lot of sessions. Just perhaps 3 to 5 sessions, just to kind of learn some biofeedback of what it feels like to contract those muscles. And then you want to coordinate that with breathing till it becomes more powerful. And all of us, men and women, should be doing that daily. And it's very easy to do. And for a man and a woman, the muscle that contract your Kegel is also the muscle that start and stop your urine stream. So when you urinate, right, there's a muscle that like start the stream, and there's a muscle that can stop it, right? Well, those are the same muscles that are Kegel muscle. So that's kind of like your biofeedback. It's like, you urinate and then you stop and start. Those are the muscle. And then another good biofeedback is to bring your hand, but for a female, it will be more actually around the labia. For a man, it's actually below the scrotum. You can feel the muscle contracts as well. So the anatomy for a man and a woman is a little bit different, and where you can feel the muscles of these muscles. There's two muscles, but you can definitely feel the contraction, and it's a hidden gem for sexuality because it does so many things. Especially for women, it also controls the urine stream as well.
Hmm. Yeah, I've had friends that have had the incontinence, and they've gone to a pelvic floor therapist for I don't know how many sessions and been able to, those issues resolve because all this, bouncing on a trampoline or doing active people are like, "What the heck's happening?"
Yeah, absolutely. For female, vaginal birth, does affect the structural anatomy that make you more prone to getting that. And then for female, the length of the urethra or where you urinate is also shorter versus a man. So man doesn't have as much urinary stress incontinent issues as a woman because of the structure of the vagina and childbirth and structure of the urethra, women are more prone to that. So like, imagine kind of like a sling, and over time the sling just sags. That's what the pelvic muscles are in for a woman. All the perineal muscles over time, childbirth, gravity, weight gain, all that just make the muscle kind of sag like that, so it becomes weaker. That's why the woman loses urine quickly when she laugh, when she trump trampoline or doing jumping jack. I had that. I was when I was exercising, I had urinary stress incontinent, and I had to go see a pelvic floor therapist. I no longer have it because I do Kegel as well.
Mhm. Yeah, yeah, it can be improved, right? Okay, so let's talk about some mistakes that can make, ED worse. What are you seeing there?
So mistakes that can make ED worse is that for the man is that there are four pillars to sexual health is diet. Good, a poor diet will kill your erection. And, like, what I mean by poor diet, high carb, high processed food. Diet I recommend is the Mediterranean food, which is more, vegetables. If you have a plate, three-quarter of it should be full of vegetables, colorful vegetables, and, a quarter to a half is, lean protein such as, chicken, fish, pork, and you can have red meat, but maybe once a week instead of, every day. I've had men that I've treated for ED that eat a hamburger every day, chips, and drink sodas, and then beer or wine at night. So diet is essential. It is essential because you are what you eat, right? And for a man to get an erection, he needs to bring in 40 times more blood flow than a non-erected state. 40 times. So what that means is that the penis has to be muscle has to be flexible to expand, as well as the blood vessel to be able to open up to bring in more blood. So that's why blood flow is essential for a functional erection. So 40 times more blood flow. So imagine kind of like a sponge. You need to bring the water in, the sponge expands, right? So having said that, what's in your blood? Food, what you eat, right? And then second, is, diet. Because, I'm sorry, the second is exercise. The first is diet, second is exercise. So why is exercise important? Because, when you exercise, and mainly what I mean is, I'm not talking about doing triathlon or anything like that. Even just walking, 3 times a week, but walking around, brisk walking, about 3 miles, where you want to walk fast, where you kind of have a hard time counting from 1 to 10. You breathe. But what it means is that when you exercise, even just walking, your heart increases, right? When your heart increases, it opens up the blood vessels, and it allows the blood vessel to be more flexible for it to expand to get more blood flow in. Does that make sense? So it's kind of like a hose, and the hose needs to expand so that way it can have more water running through it. So that's what exercise does for you. And people go, what does exercise have to do with me having an erection? It's because exercise will help bring in more blood down to the penis for a more functional erection. And then three, which is mostly neglected, is sleep, not getting enough sleep. So a man really needs to sleep between 10 p.m. to 6 a.m. because that's when his body start making testosterone. Start making testosterone between 10 p.m. to 2 a.m. And then from 2 a.m. to 6 a.m. is when the mind heal itself. It's when the mind relaxes, and so that's really the optimal time where when you make more hormones and when your body also heal itself. Physical healing for the body starts from 10 p.m. to 2 a.m. and 2 a.m. to 6 a.m. It is more a mental healing. It's a very, very important time frame. And then, so sleep is important. Number four and final one is really stress management. Right? So, as women, we can deal with stress, but what do we do when we're stressed out? We hang out with our girlfriends, we talk with family, I mean, that's how, what I see with women, especially me, is that, if I do that, I feel less stressed. But for some man, it's not, manly, right, to express how he feels with his friends or his pals and do that. So stress management, how does a man reduces his stress? If he exercise, that reduces stress. The other thing is like more breathing exercise, which I stress about using more of like a yoga style breathing where you breathe in through the nose for 4 seconds, and then you hold it and you breathe out through the nose for 4 seconds and hold. It's called a box breathing. So it helps increases nitrous oxide, nitrous oxide help increase blood flow, and it also relaxes the sympathetic nervous system, which is the stress nervous system, and then activate the parasympathetic nervous system, which is the relax and breathe system, which that again help with having a functional erection. So those are the main four pillars that we all can identify with, but oftentimes overlook and how it can really affect a man's sexual health as well as longevity of maintaining sexual vitality throughout his life.
Yeah, those foundational pillars, I think a lot of us, we know what they are, right? But it's easier said than done. So it's like being able to make healthy choices every day, getting rid of the ultra processed foods and eating more, naturally healthy foods. Because it's like if it's got a label or it's gonna have some sort of, something to tell you to eat it, it's probably something you want to avoid. Because an orange or an apple is not gonna have any kind of like promos like, "Hey, this is gluten free." Yeah, it is, but, uh, and the yeah, and the stress piece too, right? It's interesting with women where we wanna go and chat to our girlfriends, and I'll say to my husband when he goes out, I'm like, "What'd you guys talk about?" "Nothing." Like, "We talked about sports." Like, so it's like
Yeah.
not able to, yeah, it's just not a thing that they do, but being able to, yeah, and especially talking about this thing, like, this is not something that any typically guys are gonna be, like, talking about this with anyone, right? It still has a lot of shame kind of associated with it. Was the, Let's go ahead and talk about some of the underlying reasons as to why they, may be dealing with erectile dysfunction. Let's maybe talk about, what about SSRIs, like medication, things like that, where people might be taking something, they don't realize that that's what's actually contributing to the ED. Maybe talk about some of that. What are you seeing?
Right. Well, let's kind of like stress the address the big elephant in the room, which is, well, what's the number one thing that you think of when a man has ED? What is the first thing he does? He takes Viagra, right? The little blue pill, or Cialis, which is sildenafil. Viagra is sildenafil. Sorry. So either Viagra or Cialis. Well, that's like the first thing it come to a man's head, or because it's such a private thing, he'll Google, right? He'll Google and then boom, Viagra to help you get an erection again. Well, I call Viagra making a deal with the devil. It's almost like taking recreational drugs because, first of all, it only works 70% of the time. And, it mainly actually works more for men with psychological ED, which come from stress, anxiety, trauma, rather than a man that has a physical, causes of ED, which is any condition that decreases blood flow, such as high blood pressure, high cholesterol, diabetes, uh, um, and, heart disease. So, having said that, it only works 70% of the time, and that what Viagra does is that it increases, nitrous oxide, which allow more blood flow to the penis, But what it doesn't do is that it doesn't address the cause of why the man has the ED in the first place. And it may just be because he's not getting enough sleep. Or maybe because he has low testosterone, maybe because he's stressed, or maybe he has high cholesterol. Viagra doesn't lower your cholesterol. Viagra doesn't lower your blood pressure. In fact, it does lower your blood pressure to a point where you can even pass out. The Viagra was originally created as a medicine for pulmonary edema or fluid in the lungs. And then they found out that the side effect was improved erection. That's how Viagra work, but Viagra doesn't work well in men that already has poor blood flow that are existing, and that it doesn't work well if you have nitric oxide synthase enzyme or the enzyme that makes nitrous oxide that it's not functional. So there's a lot of things that goes on. And so Viagra is almost like taking a recreational drug like cocaine or heroin for that symptom that you feel better euphorically, for a brief moment, but you're not addressing the cause of the problem. But once you take it, it becomes a crutch, and you keep taking it, and it literally will hijack the how you have an erection naturally. So when you start taking Viagra, it rewire your brain and hijack your brain to be dependent upon it, that next time when you have an erection and you don't take Viagra, you're not gonna be able to have an erection. So I call it hijacking the mechanic of a natural pathway to have an erection. And we know that Viagra will only work from maybe 1 to 3 years, and that the man has to escalate or increase his dose for the same effectiveness. Because what happened over the years, the reason why he has ED because of poor blood flow has worsened. He hasn't addressed diet, exercise, sleep, or stress. So that worsen over time and so that's the reason why Viagra doesn't work. And then the next algorithm is that, either an injection of trimix into the penis, which is even more traumatic, and then a penile implant. All right. So, but what the point I'm trying to stress out is I want men to realize, and their partner to realize, that taking Viagra hijack your erection, and that it actually will even worsen your ED in the sense that your body forget how to get an erection naturally anymore, and that there are other factors that going on with your body that really doesn't work well with Viagra, and that's the reason why you don't get an erection with Viagra. So that's the elephant in the room, all right? Is that yes, it does work, but it really is addressing the symptom, not addressing the cause of the problem. But as you know, we live in a world now with quick fixes, right? We want something quick. We want result quick. And we're not, we don't have the time to put in the effort. But unfortunately, our body is old. Our body it's about 200,000 years old, and it works 200,000 years physiology. It takes time for you to reverse the metabolic processes that goes on in your body. And it actually doesn't take that long. It could be from 6 weeks to like 4 months to really kind of work on restoring blood flow. I have a patient that I saw yesterday. He's had ED for 20 years. 20 years. Viagra doesn't work on him. Cialis doesn't work on him. He didn't want to get penile implant because the doctor recommended it. He came to see us for treatment, and been now 6 months, and now he's starting to have morning wood again. And he's starting to feel that, it's becoming aroused now spontaneously. And he's looking forward to dating because, his wife passed away a couple of years ago. He's looking forward to dating again. That's why he wants to work on his direction. So the point I'm trying to make is that, and I say this, is that if a man has a penis, and if he works on it, his erection will come back. But it needs work. Anything that is worthwhile in your life that you need to work on it, and it would take some time. So that's the number one thing is Viagra, right? And other medication that is being used more prevalent, believe it or not, antacid, medication for ulcer or GERD, reflux, right? Like antacid, Nexium, Protonix, Zantac, Hepcid, I'm sure of other major things. But if you take an antacid, what the antacid does is that it decreases the acidity, that the acid that's produced in your stomach. But when that happens, it actually will decrease nitric oxide. So it decreases your ability to make nitric oxide. So you have less nitric oxide. Nitric oxide is a gas that your body naturally produces. And what it does is that it opens blood vessels for more blood flow everywhere, not just the penis, everywhere. So you make less nitrous oxide and as well. So that number one is the antacid, what I see a lot of people are on, and also fluoride toothpaste. If you use fluoride toothpaste, it decreases the bacteria in your mouth, and you need the bacteria in your mouth to make nitric oxide from the food that you eat. So if you eat like a beet or arugula that has high content of nitrate as nitrate, but in your mouth, it will become nitrite, right? The bacteria in your mouth will convert to nitrite, and then nitrite will go to the stomach, and the stomach will make it nitric oxide. And I know it's a little complicated, but you need the bacteria in your mouth, you need the acidity in your stomach to make nitric oxide. And then so I address the fluoride, address the antacid, address the Viagra, as well. And I want to address smoking. Smoking, right? And that's including vaping, vaping with nicotine. That's even including marijuana as well too. There's a couple studies that's come out that address daily marijuana use will affect erection. And we already know about smoking. Smoking nicotine is foreign. These are foreign substances you're putting in your body. When your body senses something that is not organic, is foreign, what does it do? It starts to fight against it. So it thinks that it's foreign, start to fight against it. What happens? You have inflammation. You have a higher immune system. So what inflammation does is that it causes more stress to the cells, and the bottom line is, again, decreased blood flow. Okay, so smoking is an erection killer. Vaping, frequent use of marijuana as well, and then that's and then another medication that will affect it is SSRI, meaning the serotonin inhibitor. What the medication does, it allow your body to have more serotonin available, but and at the same time, it can also affect the erection. But I don't see that as much. If you're on serotonin, doesn't mean that you stop taking it. The point I'm trying to say is that if you're on the medicine, you have ED, don't stop the medicine. First, look at the four pillars. Look at your diet, your exercise, your stress level, your sleep. Reevaluate that first and correct that before you drop your medication. Because oftentimes I see out of the everything that I talk about, medication and all that, what is the prime mover that gives a lot of changes in a positive direction for better erection? Diet. It is the diet. Is the one that if a man has to do one thing that will impact his sexual function is diet. It come down to it because I see that very, very often. Because sometimes, I will see a patient deflect. Oh, I eat fine. I'll just stop this medicine. I'll just take this supplement, and that will help me with my erection. But he still eat his burgers. He still eat his chips. He still drink his sodas, and as well. And I want to mention about alcohol as well too. That alcohol it's not a lot is bad, but moderation. So what we're looking at is about probably between 10 to 14 drinks a week is probably top, but more than that, then it start becoming more inflammatory, which is not bad. 14 drinks a week is 2 drinks a day. Or drink on the weekend, 7 drinks if you drink on the weekend. So it's not too bad. That's the number that's been kind of looked at in research as well. So I'm not asking men to be a monk, but I'm giving them parameters that they can work with. And not just giving you the cliff notes on what you need to do. It's the diet. You don't have to do everything that I mentioned. It really is the diet, the Mediterranean diet. I tell patients, stop eating food that is in a bag or in a box. All right? Is it in a bag or in a box? Or, well, sometimes canned is whole food, but if you read the ingredient, you can't recognize the name of the ingredient, you can't even pronounce it, you shouldn't be eating. Yeah, if the name has like more than 7 letters, you probably should, and it sounds like a chemical, you shouldn't be eating that anyway.
Exactly. What we put on our fork every day matters. And then the whole thing with people are like, "What's the supplement?" You can't out supplement a poor diet. We gotta take it back to
And
basics. We have people do an elimination diet, so it's only for 10 days, and then you systematically reintroduce, so it's a short period of time, and you can just start, reducing inflammation, and we have both partners do that. And so, taking out the top allergens and then, digging deeper. Interesting with the GERD and the acid reflux, we see a lot of people because 'cause they're swabbing fluids here that they have H. pylori, so they do have that lowered that stomach acid piece, and they think they have an excess stomach acid, it's actually lower, and then they're have an overgrowth of H. pylori, and that's sort of one of the themes we see people with their gut microbiome with parasites and bacterial infections, H. pylori overgrowing. And then, yeah, interesting with the fluoride, right? Where you're still going to the dentist, they wanna give you fluoride. I'm like, "No, thank you." He would like with toothpaste, just, get a non-fluoride toothpaste, and the oral microbiome has been linked with fertility as well. So it is doing the basics, right? The lot of stuff, like we said before, that we may know, but, it's, because this is not about a medication deficiency, right? It's not like, "Oh, wow, I need to have more Viagra." Like you said, if you start taking it, it might work, and then it doesn't work, and now you're just getting yourself into a vicious cycle, right? And obviously, people here are trying to have their baby, and if your partner's dealing with, dealing with ED, we need to work on his health. It's not just about you, working on your health. He's got to work on his health, and if I guess looking at with the erectile dysfunction from heart disease and blood pressure issues. Can you talk a little bit about that? Because this is kind of again, it's back to the man's health, and
Yeah, that's right. Well, like if a man has ED, it is really a warning sign that his general health is not optimal. So if you start to have ED, you gotta make first thing is, go see a doctor and check your blood pressure, get some blood work. Oftentimes I'll see a man with ED who hasn't gone to the doctor in like a decade and find out that he has doing blood work itself has high blood sugar, high cholesterol. His liver enzyme or his liver function is not optimal because he's been drinking a lot and that he's anemic. And then also, we also find out he has low testosterone as well too. Now, testosterone alone does not cause ED, but in combination with other factors such as high blood pressure and high cholesterol and diabetes, and then it does. So that's number one. You have ED, go get blood work to evaluate other causes as well. And then once you find out, hey, if I have high blood pressure or if I have diabetes or high cholesterol, what's the number one thing to lower that? Diet, right? So your heart specialist would tell you, well, you got to eat better or lose some weight, right? Because when you have high blood pressure, that means that when the heart pump out of the aorta and it goes to all the arteries in the body, arteries bring blood to the cell, the vein bring blood from the cell back to the heart. So high blood pressure means that your arteries is not flexible in stretching when the heart pump blood out of the heart. So the blood vessel has to be pliable and stretches. So that's why when high blood pressure means that it's stiff. The artery is stiff, it's not pliable. So what it means is that the pressure gets built up. When pressure gets built up, it causes more pressure to kind of go into as like imagine like an opening like that. If opening like that gets smaller because the arteries are not flexible, then there's more pressure. When there's more pressure there, then there's more damage to the cell. And that's why you have decreased blood flow. And then from there, you also have cell damage as well because there's so much pressure on the blood vessel. That's why when you have high blood pressure, is the risk factor for what? Heart attacks and having a stroke or paralysis of the extremities. So that's what high blood pressure means. And high cholesterol, that means that the food you eat, your liver is having a hard time dealing with it, and it produces these fatty molecule that float in your blood, and those molecule actually attaches to the blood vessel, the artery, which then again decreases blood flow because you have an opening like this and you have the cholesterol just stuck on the side. Well, you have less area for the blood to flow. So again, that contribute to decreased blood flow. And then diabetes is even worse. So diabetes means high sugar floating in your blood, and sugar actually will attaches to the blood vessel wall, and then what it does is that it will grab that. If you have high cholesterol, it will grab that fatty molecule and will stick to the inside of the artery, again restricting blood flow. So if you have the combo of high blood pressure, high cholesterol, and diabetes, that's the worst thing. That is really waiting for a heart attack or stroke unless what do you do? You can definitely reverse it. Definitely, it is not something you inherit. You don't inherit that. Yeah, you have a family history, but you don't necessarily mean that you're gonna get it. A lot of people say, "Well, I'm on medication. I'm on blood pressure meds, and I'm on cholesterol meds. I'm on diabetes meds." I don't have that anymore. No. When you take medication for those conditions, you still have it. The doctor give you the medication so that way it decreases the adverse effect of what high blood pressure, what high cholesterol, what diabetes can do for you. But what you can do is to change your diet and exercise, and that will again decrease your blood pressure, decrease your cholesterol and your blood sugar as well. Because when you exercise, people say, "Well, if I change my diet or exercise, how does that help with my blood pressure?" And as I said earlier, when you exercise, your heart rate increases. When your heart rate increases, the blood from the heart pump the blood out, and when it does that, it stretches the artery. When it stretches the artery become more flexible to allow more blood flow. That's how exercise help with increasing blood flow. And so the point I'm trying to make is, I would tell you, probably the 1800, the incidence of ED is probably very low versus what we see now. And what I want to have your listener know that now more than ever, more men are facing with ED because of the availability of porn, how accessible porn is, and porn does rewire your brain to get aroused. Alright? And so when that happened, when you get aroused from watching on the screen, but then it messes up with your brain to get aroused when you're with a real person. And that's how porn messes up with erection, because it kind of rewire your brain, and your brain have a hard time getting aroused when you're with a real person. And I can tell you probably 90% of the men I see either had watched porn in the past or still watching porn, but they don't realize the impact of that on their sexual function. So porn is almost like, smoking, yeah, it's not good for you. And you shouldn't watch it. Because it does kind of affect the way how your brain is rewired and how I was just talking to an expert in porn addiction, and she's a neuropsychiatrist, and it's essentially 2 times of watching porn will start kind of affecting the chemistry in your brain, which I thought was like, wow, that's pretty shocking as well.
'Cause so many young the young kids are starting with Pornhub and all that sort of stuff when they're 12 because they got all the internet access to the internet, not like in the old days when you're out with the Playboy or the Playgirl, whatever. You know? Um, but yeah, back to the health just for 1 minute, we gotta wrap it up. So, it's interesting, right? You go to the doctor, they're gonna put you on metformin, on a statin. No one's gonna talk to you about, "Hey, why don't you do a continuous glucose monitor, work on your blood sugar," and you don't want it to be managed, you wanna reverse it, and this could be a reason why, why you're dealing with ED and why you're having issues with potentially if you're having issues with your semen as well. So, we've got I think for you, you've got a good morning wood smoothie that we're going to include here in the show notes. They can get that at, hardpan15.com, but we'll have that in the show notes. Any final thoughts for us here, Dr. Ann?
Yes, so the final thought is this, if, your listeners are listening, men and women, just know if a man has erectile dysfunction, that it can be reversed, and if you do have ED, don't go for that, medication like Viagra or Cialis. Get your blood work done, look at your diet, look at your, are you exercising? Are you at, how's your weight? And start with that first. But I mentioned the 4 pillars, which include sleep and stress reduction. But before you go for that medicine, just know, be real with yourself, be honest with yourself, and start doing an introspection of what your lifestyle is about. And just know that your sexual function is there. It's hidden. You need to do the work to get it back, but it will come back because we have seen patients 20 years plus with ED and now having function again, but he has to work for it. He actually lost 50 pounds just eating the Mediterranean diet, and now he's having morning wood again. So I want to be able to tell men that there are hope, as well as their partners, the women, that there are a hope to getting your sexual function back.
Absolutely love it. Thank you very much.